behalf of the citizens of Mount Vernon to bring back full services to this hospital.
Yes, sir.
Full services.
Yes, sir.
I will keep it 100. Full services. No longer we're asking to be driven to Jacoby Hospital. No longer are we asking to fall back on the 70,000, 80,000 citizens that live here in the city. We demand better. There's no way our taxes are high as Westchester County, and we're like a third world country here in the city. I'll speak later. What I'm going to do is hand the mic to Lauren Razor to speak. Thank you.
Yes, sir.
Thank you, Jesse, of Save Mount Vernon. Good afternoon. My name is Lauren Razor, and I'm an attorney here and an activist and an advocate here in Mount Vernon. The reason why Save Mount Vernon and folks like ourselves are out here because we've had enough time and we've had enough. Something happened recently that was not far away from this hospital. And a young lady who was a victim of an assault passed away, but she didn't come to Mount Vernon Hospital. She was taken somewhere else. We're not making any assumptions about what happened on her way to the other hospital, but we're saying now that the elected officials here, we've had enough waiting, we've had enough proposals, we've had enough town hall meetings, we've had enough table talk. Our people, we're no different than Bronxville with a hospital that's servicing the people of Bronxville. We're no different than New Rochelle. We're no different than White Plains. We deserve services in this community. And if there has to be a tragedy that mobilizes the entire community, we've had enough time of talking.
Yes.
So we're asking these elected officials to go to Governor Hochul and say we want a hospital that has a trauma center. They are erasing our history because babies cannot be born here.
True.
That people have to leave here and will not have history where they can say, I was born in Mount Vernon. Now, I'm not going to sit here and say what's diabolical or it's part of the plan, but we are not waiting, and we're going to hold folks accountable. But no more talking, no more town hall meetings. We want this done, and we need a hospital. I'm going to read a statement from a former elected official, if you don't mind, Jesse. Montefiore Hospital has a priority, and this is not a political rally. There are no endorsements here. We have to come together, the former mayors, all the mayors, the elected officials. It's not about who's who. It is about getting stuff done. Montefiore Hospital has a priority problem. The excuse of monetary constraints denying first-class trauma-level equipment for Mount Vernon patient care is false. Mount Vernon spends more than $4.3 billion annually. That's more than the world-renowned Yale New Haven Hospital, Hospital of University of Pennsylvania, Duke University Hospital, and the Johns Hopkins Hospital. During the pandemic, the Montefiore system received over $250 million in aid.
Where's the money?
On top of the millions they obtained based on local community needs. Yet talented doctors, dedicated nurses, Deserving people are treated like second-class citizens in Mount Vernon. Montefiore's pattern and practice of shifting federal and state monies meant for Mount Vernon patients must end. Montefiore can afford to provide access to trauma care.
Yep.
If a child dies over there because we don't have trauma care, we have to take them somewhere else, and enough is enough. The neglect, the disrespect, and the disregard for the people of Mount Vernon by Montefiore is a disgrace. We must keep the pressure up on Montefiore and their lobbyists to actually invest in Mount Vernon. Again, former Mayor Richard Thomas. We are together. This is not a political rally. Every elected official, former and after here, must come together and stop what they're doing to this community.
True.
At some point, we have to say,
Enough.
it's enough.
Thank you.
Thank you.
Thank you.
Thank you, Lauren Razor. This time I'll let Jeff Monroe, another member of St. Mount Vernon, speak.
Thank you, Jesse. So I want to thank everyone for coming out. I want to really put on the table at this moment a message to the community, to the people, right? We have a lot to say, and rightfully so, to our elected officials and to the corporate entities that run these hospitals. But to the people, I want you to remember not to let the propaganda rule you, not to let the wrong messaging misguide you. We have to remember that a lot of the understanding that we have needs to come from a true, our experience, first of all, but a true factual, historical understanding. You know, we don't have just bad kids that make bad schools and criminals that make bad communities. We don't just have bad CEOs that make a bad hospital run by a corporation. We have bad systems. In the 90s, we had a Republican mayor that brought stop and frisk to talk about broken windows theories and how to so-called fix crimes in the community. Rudolph Giuliani was really, to a lot of people, a really bad person, but it didn't matter because an independent party mayor, Mayor Bloomberg, came back and kept stop and frisk in place, and even had to fight a federal judge to stop the implementation of stop and frisk. And then we had a Democratic mayor, Mayor de Blasio after him, that still tried to bring back still fight for stop and frisk. We have a Democratic mayor, Eric Adams, right now, re-implementing stop and frisk. So remember, these are systems, not just people. We had bad schools in Chicago under a Democratic mayor, Rahm Emanuel. Instead of directing schools and resources, he directed attention to charter schools, and he shut down a bunch of schools in Chicago. So let's not be tricked by the Democratic-Republican dichotomy false narrative. Remember, Mount Vernon, we have a hospital here run by a corporation that has several other hospitals in the area that they direct resources to. We need to keep asking, where's the money? They have profit centers in the Bronx that they treat rather well, profit centers in New Rochelle and other parts of Westchester that they treat rather well. All of a sudden, Mount Vernon's profit center is too poor, so they want to shut it down. Why is that? How is that? You got to ask yourself, what kind of system do we live under? Where's the ICP money that comes from the state to indigent communities for health care? Why is New Rochelle and Montefiore and the Bronx getting money that Mount Vernon is not? That's the question you should ask yourself. Don't be impressed by a black CEO. That's not what's going to change the dynamics here. And don't be too emotionally manipulated with the stories of our many tragic stories of our children and individuals in the community suffering and dying because of a poor social and civic and economic and educational and all kind of other systemic problems that are causing our suffering. That's not going to change with one election. It's not going to change with one hospital. But you got a system you got to question, and you got to wonder why the hospital is subject to that system, and frankly, why we aren't fighting hard enough for it. So that's what I want to leave today. I want you to remember as I close that we actually have and again, I do organize with the Poor People's Campaign, so obviously I'm not speaking for them, but I am in solidarity with Reverend William Barber's Poor People's Campaign right now to mobilize for June 18th. If you're in Mount Vernon, you should remember that Poor People's Campaign was initiated by the Reverend Dr. Martin Luther King in 1968, just before they assassinated him. And remember that this campaign at the time was not just for votes. It wasn't just for some good person to come into the White House or Congress. It was to change a whole system, an economic system, a system that makes one people poor so that it can make another people rich. That's what you got to remember. And while you're voting for people that are sending $54 billion to Ukraine, you got to wonder why they're not sending at least a half of a fraction to that money to places like Mount Vernon. You got to wonder why missiles, bombs, and war are worth more than health care in this country and education. That's the question we should ask ourselves. So thank you, everybody, for coming.
Thank you. Thank you.
Thank you, Jeff. Monroe. Let me ask you, we're standing here for a reason, to save this hospital. There's no way that our citizens are being neglected and mistreated. The doctors are having a problem in there, working double shifts. So you tell me, what are we supposed to do? We can't take it. And we're here for an incident. Kayla Green, God rest her soul. A block and a half away from here, her life was taken. She didn't come to Mount Vernon. They took her to Jacoby. And you ask me why? Why are we standing here fighting? Because we can't take it no more. Enough is enough. This right here says hospital should have full services in here. Asthma patients, ICU, trauma unit, pediatrics. You tell me, the list is long. The list is long. Are they trying to shut it down? This ain't urgent care. We're not going for it. And why we just said no elected officials coming here today, because we're tired of them talking. We're tired of them lying to us. We're tired of them mistreating us. We deserve better in Mount Vernon. It's a long list. A long list. And for the next child to possibly lose their life, and I got to take that 10-minute ride to Jacoby, it's unacceptable. This block should be flooded right now with citizens of Mount Vernon. You don't want to speak, but Jesse will speak. Save Mount Vernon will speak for you. We are here for you. We ask the CEO of Montefiore, step up. Step up your game. Where did the money go? White Plains got a new hospital, state of the art. North Shore got fixed up. This hospital since 1976 hasn't done nothing to improve it. 2014, I had a mild heart attack. They couldn't do nothing for me. I had to go straight to Lawrence. The nurses said there, I took a chance going there. We can't do that no more. We're asking, save this hospital. Bring our services back. Bring full services back. I understand the ICU unit here is a makeshift. The next day, they're still going out. The next day. And then Montefiore wanted to say this morning, her injuries, she wouldn't have made it anyway if we had a trauma. It's bull. It's bull. How would you know if she never went inside them doors over there to get treated, to get stabilized on the way out somewhere else? So what we asking? Elected officials, Governor Hochul, we're asking you to get involved. You gave Mount Vernon $150 million for the sewer system. Our lives don't matter. If you give Mount Vernon $150 million for the sewer system, well, damn it, you can give us money to save this damn hospital. It's no excuse. Governor Hochul, help. We need it here in Mount Vernon. We're going to flood it. There is a next step. We don't have a problem going to Albany. And at the end of this message, it is election year. Remember that. We will remember it is election year. It's not a threat. It's a promise. We need better here in Mount Vernon. Our elected officials are lying to us. They're telling us we have this, we have that. We have nothing here. The city is dry. The city is broken. Everybody knows the city is broken. From the library, the police department, Board of Education, the city is broken. So we ask for better. The federal government step in, find out where this money went for the last couple of years from the COVID. Find out. Nobody knows where it went. It definitely ain't going to Mount Vernon Hospital. So I thank everybody for coming out. hear me raise my voice right now, but it's okay.
One last thing.
Lauren has one more thing to say.
When we're talking about the neglect of our community, we don't have, I looked around all of Westchester, everybody seems to have a Y, a W, a YMC with A. We don't have one where the kids can learn how to swim, because we're putting these elected officials on notice, okay? Number two, I looked around all of Westchester. New Rochelle has a music school. White Plains has a music school. We don't have a place that houses young children in music schools. So this is just part of the plan to dismantle everything for our people here. And what we're doing now with these buildings that are going up, we're bankrolling Yonkers. All we do is take our money out of Mount Vernon and go down the block and spend it in Yonkers. Every building that goes up with nothing here, not a Starbucks, nothing here, we go and we spend money in Yonkers. Today is the day that we're serving notice to the elected officials that thank you for coming out here, but we can't take this anymore. And we're going to serve notice on these elected officials that this may be your last term. It may be. Thank you.
Thank you.
Yeah, and to close it, she's correct with everything she says. So later in the day, I know you're looking for a rebuttal. Shawn Patterson Howard is going to come and try to put icing on the cake to smooth over everything we said, but I don't care. Address me, because I will address you tomorrow. The city's broken. How much have you fought to save this hospital? Mount Vernon is leaving Yonkers and gunshot victims. They pick them off the ground and go straight to Jacoby. Unacceptable. 2 minutes right here to our emergency room. Mount Vernon should have a trauma unit. On the transportation there, ETAs they call it, 10 minutes, 11 minutes, you might not make it. I'd rather take my chances with a trauma unit here in Mount Vernon and me coming right here to save my life. Our elected officials, do something. Reach out to Hochul. If she could come down here in City Hall and sign over $150 million. There's no way in hell that she cannot provide the city services to help move this hospital forward. That's where we're going with it today. We need help. Governor Hochul, we are reaching. We are reaching. I want to thank everybody again for coming out. Thank you.
Thank you.